Hi, Kathy Linville here from Laerdal Medical, and today we're going to be looking at the Modular Skills Trainer 2, or better known as the MST2. So let's just unbox it. It does come in a brown box when it's shipped. When they unpack it, it does come in this nice little white box with a handle here. So if instructors wanted to reuse this, right? They could and maybe pack everything away in this box for easy storage. So right now I've unpacked the base here and the face of the Modular Skills Trainer. This comes off of it, just easy to insert through these holes and put your face on here. This is an injection pad. This is a wound packing pad that fits right in either one of these slots here. Then we have our IV start or catheterization pad. It can actually be filled with simulated blood, so the veins here are full of blood. So when you do catheterize, you get that nice little flash back. This is an extra platform that allows you to put your female parts in here, so you can practice urinary catheterization as well as enema, perineal care, or any suppository that might need to be administered vaginally or rectally. We have our pad that has, this might be a little hard to see, has a larger hole here and 4 holes here. It's for a central line. So you're able to actually put the sutures in as well. It does come with sutures. And then students are able to practice central line dressing changes. And this is our ostomy care. So this pops out for easy storage, pops right back in, sits here as well, or on the other side for ostomy care. It also comes with this nice little travel bag here. Has a large opening here, fits all of this in it, and then a smaller space for maybe some of the smaller devices, like if the stoma came out, the sutures would fit nicely in there. And you can put a name on it. So if students are, if this is part of the student package or lab fee, sometimes schools will put this into the lab fee for students, and so they get their own so they can practice these skills anywhere, anytime. It is very portable solution, and it practices 16 different skills. So the NG2, wound care, trach care, right? Nasal swabbing, central line dressing changes, like I said, ostomy care and stoma care, urinary catheterization and enema, as well as injections, right? IM injections, and then IV and phlebotomy, not there, but here. Wound care, I said that already, but both rectal and vaginal suppository insertion, perineal care, oxygen delivery device care, so any oxygen delivery device, nasal cannula, non-rebreather, nice way to show where that needs to lie above the patient's ears, and then what happens when they have a wound on their ear. What do we do with that? Also G-tube care, so very versatile and very nice for, like I said, those nursing students to practice independent skills and become very competent and confident. But what about using this in the hospital for onboarding and skills validation? Or what if there is an equipment change and the educator needs to go over some of those equipment changes and deem competency on using the new equipment? They can bring this right out to the nursing floor and be able to capture those nurses and check them off on new equipment use. Let's talk about nursing homes or long-term care. What about home care? We don't talk enough about home care, and what they need to do with the caregivers at home. So if a caregiver goes home with a stoma and maybe needs ostomy care, the visiting nurse could bring this out to the home, or if they're going to visit in the hospital before they leave, they could actually teach on this, how to change and take care of that ostomy, or even trach care, or even oxygen delivery devices. Or what about a wound that they might need to be able to change dressings for that individual? So, a very nice device to be able to do that as well. If you have customers that may be interested in this and you need help, please contact me. If you have questions about this, please contact me and I'll get you more information on it. Thanks for watching and have a great day.